Hi, my name is Dr. Ankit Patel. I wanted to go over some information about bariatric surgery. Some of it you may already be aware of, but I wanted to go over some of the details regarding the actual procedures and surgeries before our clinic visit so we can focus more on you and what makes you unique and which operation makes sense for you. Overview for our clinic visit. Main thing is to discuss your overall goals for surgery, what to expect before and after surgery, what are the pros and cons of each procedure. Ultimately, we use this information to make sure um, we pick the operation that makes sense for you. And ultimately, we want to make sure we have enough time to answer all of your questions. So at the end of the day, what does surgery do? It doesn't really matter which procedure you pick. It really helps you jumpstart your journey to a healthier lifestyle. Some people need a little bit of weight loss just to become a little bit active. And once they become more active, that's when the weight comes off and when you become a little bit more healthier. So ultimately it boils down to dieting and exercise. At the end of the day, it's a math equation. What we eat, we need to burn off to make sure that we keep our weight stable. Initially, we want to burn a lot more calories, and then one day you'll hit your goals, and we want to make sure that we at least burn the same amount of calories that we're taking in. How do we perform these surgeries? They're all done similarly, laparoscopically or robotically, or what we consider minimally invasive, which helps with your overall recovery as well. Most people will spend at least one night in the hospital. Some people may need extra time depending on if they have other medical issues or conditions. You can shower the next day. You can walk immediately after surgery. In fact, that's very important after surgery to decrease the other complications that can happen. You can go up and down stairs. You can even drive after a few days if you're not taking any pain medications and feel good. Overall, there's no major restrictions except no heavy lifting more than 10, 15 pounds for about 2 to 3 weeks. But it all depends on your jobs, work, whatever the restrictions you may have. As far as diet goes, everyone's on a liquid diet for at least 1 or 2 weeks. What I consider the baby diet. You're on liquids, soft foods, and then transition to regular foods. Sometimes they can take a month or two to get there. And our overall goal is to make sure that you eat healthy, smaller meals, and healthier versions. The most important thing that I tell everyone is mentally you may feel great, but physically you may feel tired. The first week or two may feel like you have the flu, tired, no energy. It's almost like your gas tank's almost on empty. Whatever you're eating, drinking is going towards healing, so there may not be much energy left over. So be active, but rest when needed. Don't expect to lose a whole lot of weight. Again, we're not really dieting, nor are we exercising. So you may lose 5 to 10 pounds the first month, but don't be discouraged. The main goal here is to heal. Without healing properly, can't really enjoy the fruits of your labor. So let's dive into the surgical options. I do not offer the gastric band, have not done that for several years, and it doesn't really work for most patients. So the main two operations are the sleeve gastrectomy and the gastric bypass. On the sleeve, we physically remove 75 to 80% of your stomach. Imagine this is like the elastic in your socks or underwear. This is the part of the stomach that stretches out quite a bit, gives you a lot more capacity. By removing it, this is how you lose weight. So it restricts the amount of food that you can eat. Most people will lose about 60% excess body weight loss. This is an average. Some people can do a lot more. But if you don't make any of those fundamental choices, you may not lose much at all, except the first 20 to 30 pounds that comes with the operation. There's less issues with taking medications. Some people need medications like for seizure disorders or immune disorders where they have to take a certain amount and at certain times of the day. It doesn't interfere with that because it doesn't change any of the absorption of these medications. There's also less interference from prior surgeries. So if you've had multiple surgeries, usually this area is untouched and more likely that we're successful with this operation. The gastric bypass. It is still the gold standard, meaning like it's still one of the best operations you can get. This is where we create a small stomach, so we don't take anything out, but we also have to reroute your intestines. So not only do you restrict the amount of food you can eat, your body doesn't see some of the food. Our stomach is the grinder at the end of the day, but most of the absorption happens in your small intestines. By rerouting some of it, your body doesn't see certain amounts of food, and you end up losing a little bit more weight. On average, the weight loss is about 70% of excess body weight loss. It's better for diabetics, especially people that haven't been diabetics or haven't had diabetes for a long time. They may be taking doses of insulin. Most people will get rid of it within the first few months after surgery, especially after with weight loss. This operation is also great for people that have severe heartburn or acid reflux. This is actually one of the original operations for heartburn, but then it evolved into a weight loss operation as we moved more bowel around. So if you have really bad heartburn, take multiple medications, this is a great operation. And overall, as we mentioned before, it's better for overall weight loss as well. Complications are about the same. The one we always worry about is a leak, meaning like a hole in one of the connections or where the stomach was taken out. We are not a factory for these operations, meaning like I don't do 10 of these a day. We really focus on you and trying to get the best outcomes that we can, but it's not zero. It's not unavoidable. And I always worry about you for the first month for any of these issues that can happen after surgery. Long-term management, everyone has to take some vitamins. The stomach absorbs B12 and vitamin D, so you always need a little bit of that for the rest of your life. Most people end up taking B12, vitamin D, calcium, and a multivitamin. If you do that for both operations, you'll be fine. This also involves checking your labs once a year. In the beginning, you'll be checking it quite often, but once you're on autopilot, we at least check it once a year, just to make sure you're not losing any extra vitamins or don't need any supplements. We also tell you to avoid certain medications like NSAIDs, like ibuprofen, Motrin, Advil, Goodies, Aleve. They're great drugs, but they tell you to take it with food. With these operations, you're not eating as much and you can get ulcers very quickly. And the most important thing, if you were a smoker or never a smoker, don't pick it up. Otherwise, it could cause major complications afterwards. So overall, you really are trying to figure out which one makes sense, a sleeve versus a gastric bypass. Both are great operations. They just work a little bit differently. With the sleeve, a little bit easier, a little bit less issues overall with it. But let's fast forward 10 years down the road. You also want to make sure that you're very compliant with it. Otherwise, if you start eating a little bit more, the stomach could stretch out a little bit more. It will never go back to what it was before, but you may lose the restriction you had or the fullness that you had if you don't watch your portion control. It's also great for patients that have a lot of other medical issues where you're taking medications. It doesn't interfere with that. Versus the gastric bypass, it's a great operation, a little bit more of an operation, a little bit more bang for your buck, but there are other risks involved with it. Things like internal hernias or / bowel obstructions. Those tend not to happen with the sleeve since we're only operating on the stomach, versus bypass, since we're operating both on the stomach and the intestines. Sometimes with a lot of weight loss, you can get little nooks and crannies and you could get a bowel blockage. Most of these require surgery to fix them, but if diagnosed early, doesn't lead to any major issues. It also has some quirks as well. If you eat too much sugars or carbs, you can get something called dumping syndrome, where your body basically hits the eject button and you have to go to the bathroom immediately. We definitely don't want you to do that all the time, but it does kind of give you a barometer on how much to eat and when not to cheat on your diets. So at the end of the day, we'll be discussing both of these operations and where you fit in. There's no one size fits all. We have to make sure that we pick an operation that you'll use and be successful with. To be honest, we do not get a commission for either one of these operations. We're judged on our long-term results. We want to make sure that we can get you to the goals that you're looking for, and we do it safely and take in and walk you there on that journey. This takes a big team. Our job is to make sure that the surgery part goes well, and then the medical team helps you with your other issues. So with that, I will see you at our visit, and we will see which operation fits best for you. And again, make sure that we individualize these therapies so you can be successful with these operations.